Pranjali, what time shall we start?
We're live now, huh?
Yeah, you can. Once you finish the introduction, just let me know when to share. I'll start. It's a short presentation, half an hour.
Ma'am, we are live now. So Pranjali will soon and give us the introduction, okay?
Fine.
Yes, ma'am, we're live.
You asked me when to start sharing the screen. Okay.
Yes, ma'am. Alright. So hello everyone and welcome to today's session. And this is the eighth part of a week-long series of the Webodontia. And these events are brought to you by the Rotary Club of the Caduceus, an organization of youth, medical and paramedical students. The Webodontia is a week-long event with educational webinars blended with fun activities. And before we begin, I'd like to mention that a recorded version of this webinar will be available on our YouTube channel, and the feedback form for revealing certificates will be given on the chat box of Cisco WebEx as well as YouTube Live. And with that being said, I'd like to gladly introduce today's presenter. And so today's presenter, Dr. Tejavathi Nagaraj, completed BDS in 1988 and MDS in 1996 from Government Dental College, Bangalore. And she has been a faculty since 1996 and has a practice of over 30 years. She has established a practice of over 30 years and published around 75 articles. And she has availed RGUHS research grant twice, doing research and OSMF, and she has been conducting research on OSMF and Hepcidin, and is currently a professor and head of the Department of Oral Medicine and Radiology at Rajiv Gandhi College of Dental Sciences, Bangalore. And she has over 20 years of experience and many national and international publications to her name. And she's presently an associate director of 3 international journals. And today we are related to have you enlighten us about aeronautical dentistry, ma'am. And this topic is very close to my heart, and my colleagues had too, as we were very keen on listening about this topic. And thank you, ma'am. Over to you, ma'am.
Thank you, Pranjali, for your introduction. Just give me 2 seconds. I'll just start sharing my screen.
Yes, ma'am.
Shall I start? Pranjali,
Yes, ma'am. It's visible.
good evening, everyone. I'm going to give you a very short introduction, or I can say, yeah, it is an introduction only to aviation dentistry. As you said, it's very close to your heart. It's mine also, and to my son also. He is very much interested in aviation dentistry. Good evening, everyone. I welcome you to my short webinar. Coming to the contents, I have introduction, head and face barotrauma, parodontologia, odontocrexis, endodontics, restorative dentistry, prosthodontics, oral surgery, periodontal considerations, periodic examinations, flight restriction, conclusions. Introduction. What is aeronautic dentistry? Aeronautic dentistry is a developing science which studies the influence of flying and its effects on oral cavity. It has gained popularity in recent years and is frequently observed in flyers, crew members, pilots, etc. During flying, the aircrew is accountable for the survival of the aircrew members and passengers and for efficiently finishing the flight. Aviation dentistry deals with the evaluation, principles of prevention, treatment of diseases, disorders or conditions which are related to oral cavity and maxillofacial area or adjacent and associated structures and their impact on people who travel or on aircrew members and flight restrictions. Association is represented by aerospace medicine specialists, flight nurses, physiologists, psychologists, environmental and human factor specialists, dentists, optometrists, and researchers in this field. Flight. Unexpected helplessness could jeopardize the flight's protection. Thus, a person's fitness is of utmost importance. In the human body, there are several organs such as facial sinuses, lungs, stomach, and middle ear comprising gases which incline to enlarge at low atmospheric pressure. Due to closed chamber, pressure gets gathered in these organs, causing pain, discomfort, and organ dysfunction. Extreme altitude changes may cause dental abscesses, deep carious lesions, and deep unlined restorations in the oral cavity, which can stimulate severe pain. Coming to Boyle's law, what is Boyle's law? Boyle observed that the product of the pressure and volume are observed to be nearly constant. The product of pressure and volume is exactly constant for an ideal gas. It states that the pressure of a given quantity of gas varies inversely with its volume at constant temperature. An example of Boyle's law in action can be seen in a balloon. Air is blown into the balloon. The pressure of that air pushes on the rubber, making the balloon expand. If one end of the balloon is squeezed, making the volume smaller, the pressure inside increases, making the unsqueezed part of the balloon expand out. The volume of a gas at constant temperature varies inversely with the pressure inserted on it. It's the simple physics of Boyle's law, which states that whenever you exert pressure, there is expansion on the other side. Similarly, the same thing happens in the human body as well. Wherever there is gas, it tends to expand when there is barometric change in the barometric pressure. Coming to aviation or aeronautic dentistry, aeronautic is one of the branches of dentistry in which we come to know about the study of dental aspects in aeronautic environment. The perspectivization branch in dentistry has shown its importance in the screening of oral cavity, treatment as well as forensic or legal point of view. Aviation or aeronautic dentistry can be used in many things. That is, it can be used for your diagnosis, it can be used for your treatment as well as for your or legal point of view. What is decompression sickness? Decompression sickness is a disorder in which nitrogen dissolved in the blood and tissues by high pressure forms bubbles as pressure decreases. Symptoms can include fatigue in muscles and joints. What is head and face barotrauma? The occurrence of barotrauma is very well observed during diving or hyperbaric oxygen therapy. We do hyperbaric oxygen therapy during radiotherapy. When you come to final year, when we teach the radiation biology, in that we have the tissues which are high in oxygen are radiosensitive. But most of the necrotic tissues, they don't have much of oxygen, they are radioresistant. To make the tissues radiosensitive, we give them the hyperbaric oxygen. They're talking about the hyperbaric oxygen. So the occurrence of barotrauma well observed during flying, diving, or hyperbaric oxygen therapy. It shows the variation in the volume of the gas inside the body's rigid cavities, which is linked with the variation in lowered atmospheric pressure, causing several harmful effects. It may lead to various conditions such as external otitic barotrauma, barotitis media, barosinusitis, barotrauma, related headaches, dental and barodontalgia. According to Harvard University, there are various definitions given for barotrauma. According to Harvard University, they say is the injuries caused by air or water pressure and in the such as in airplane and scuba diving. That's according to the Harvard University. What is barodontalgia? Barodontalgia, previously it was known as aerodontologia. 25 to 30 years back, we were taught as aerodontology and odontology. Is a toothache caused due to barometric pressure in an asymptomatic tooth. Barodontologia is a symptom rather than a pathological condition. It is defined as an oral, that is dental or non-dental pain caused by a change in barometric pressure in an otherwise asymptomatic organ. Often it is an exacerbation of pre-existing subclinical oral disease which flying at altitudes of 600 to 1500 meters and during diving at depths of 10 to 25 meters and occurs due to the entrapment of gases in the closed chamber, due to which it is unable to adjust to the internal pressure. Pain is generally sharp or squeezing in nature. That is, barodontologia is a symptom rather than a pathological condition. The patient or the person can experience dull pain is a change in the altitude. It can be either flying high, that is 600 to 1500 meters high, or during scuba diving, that is 10 to 25 meters when you dive. Scuba diving also causes this barodontologia. On the ground, the tooth which was asymptomatic can become symptomatic in an airplane. For example, deep carious lesions can become symptomatic. There could be a otitis media, that is, you can, whenever you go to a higher altitude, on mountains, hills, your ear gets to tend clogged. For that, you have to yawn or swallow, it pops out and opens. Similarly, the same otitis media. There is entrapment of air in the sinus, due to which there is pain in the frontal region, that is aerosinusitis. Occurring on both ascent and descent is irritative disease. During flight, on ascent it is associated with vital pulp tissue and on descent it is associated with pulp necrosis. The pathogenesis of barodontologia was given by Howard in 1972 and he divided it into two main broad groups as direct and indirect groups. In the direct barodontologia, the reduced atmospheric pressure leads to direct effect on a tooth on the effect localized. Moderate to severe, which usually develops during takeoff. Whereas in the indirect type, pain occurs due to stimulation of the superior alveolar nerves at the time of maxillary barosinusitis and is dull, poorly defined, involving the posterior teeth and develops during landing. So, the barodontologia, you have direct and indirect. In the direct barodontologia, the reduced atmospheric pressure leads to direct localized moderate to severe direct and it usually develops during takeoff, whereas in the indirect, pain occurs on the stimulation of the superior alveolar nerves at the time of maxillary barosinusitis and this is dull, poorly defined, involving the posterior teeth and develops during landing. One is during ascent and one is during the descent. Direct and indirect barodontologia. What is Odontocrexis? High altitude environment, pre-existing leak restorations or recurrent carious lesions beneath the restoration may cause tooth explosion due to the accidental expansion of gas which was trapped beneath the restoration. Calder and Ramsey reported that poor quality restorations with or without caries may cause tooth damage. See, you can have the restorations. It could be secondary caries or it could be fractured or where no proper lining material has been given, where the restorations are faulty, that is leak restorations, can explode. This is called as Odontocrexis. It can occur while flying at high altitudes or it can occur during scuba diving also. Whenever there is change in the atmospheric pressure, the gas builds up inside the tooth cavity and the tooth can explode. So it's a rare occurrence. This is Odontocrexis. The tooth will on the land during flying or during scuba diving can just explode due to the entrapment of the air. Endodontics, coming to the first one is endodontics. Since 1940, pulpitis is the chief reason of parodontalgia from 1940 to date. Endodontics is the chief reason of parodontalgia. Rossi recommended endodontic treatment in cases of deep dental contraindicated direct pulp therapy. He always said RCT or the root canal therapy has to be done instead of doing the pulp capping. Rossi recommended endodontic treatment in cases of deep dental caries involving pulp and contraindicated direct pulp capping in such patients. As a precautionary measure, while executing multi-visit endodontic treatment, the dentist should send the patient to patient as in a pressure-changing environment, and open unfilled root canals can cause facial emphysema as well as leakage of the intracanal infected content to the periapex tissues. What is facial emphysema? Facial emphysema is the subcutaneous facial, it's also called as subcutaneous facial emphysema. It is a less frequently encountered complication of dental treatment where penetration of air into the subcutaneous and facial plane results in distension of the overlying skin. That is the facial emphysema. Coming to restorative dentistry, the arrested or the secondary caries are minimal in our daily life, and at this lesion is not active. Its progression towards the pulp tissue is usually less. As you all know, arrested caries most of the time they don't cause any symptoms. In a study by Sognes et al., they observed that such prone to risks in a pressure-changed environment and should be removed. Hence, for deep carious lesions, indirect pulp capping technique, in which leathery, softened and wet pulpal dentin is not removed but sealed, should be done. See, again, it is left to the discretion of the endodontist. He or she should decide on the symptoms for everything. Whenever a patient approaches you, the first and foremost for you to come to the diagnosis is a detailed, thorough case history. Elicit as much as possible from the patient's history. So depending on the patient's symptoms, the endodontist can definitely decide whether you have to do the direct pulp capping. Direct pulp capping is contraindicated for people who have to fly. So indirect pulp capping or endodontic therapy has to be done. It's left to the discretion of the endodontist depending on the symptoms of the patient. It is optional for air crews which are daily exposed to barometric pressure changes. After carious tissue is removed, the clinician should carefully examine the cavity floor and should observe its approach toward pulp chamber and protective cavity liner. For example, glass ionomer cement should be applied before restoration of the cavity. Again, I repeat it. It is optional for air crews exposed to barometric pressure changes. After carious tissue is removed, the clinician should carefully examine the cavity floor and should observe its approach toward pulp chamber and protective cavity liner. That is, example, glass ionomer cement should be applied before restoration of the cavity. Coming to prosthodontics, it has been observed that the retention of dentures in both the jaws is based on atmospheric pressure, adhesion, and gravity. And then if there is a barometric pressure, it may lead to the impairment of the retention of the complete denture. In crowns, pressure changes occur in microtubules of the cement layer, which result in a reduced retention of the crown. Lyons et al. Studied the retention of crowns to extracted teeth in environmental pressure changing conditions. and concluded that the crowns cemented with glass ionomer cement or zinc phosphate cement had reduced retention tooth, which can be due to the porosities present at the time of manipulation of zinc phosphate cement and glass ionomer cement. If you can just recollect, in your second year, we are taught to mix the glass ionomer cement as well as the zinc phosphate cement to the luting consistency. We, we are being taught to do that because to remove the gas porosities in the mixing cement. In case that is there, it can explode during the barometric changes. This happens in the crowns and bridges. If you have not mixed the zinc phosphate and glass ionomer cement well during the cementation of crowns and bridges. The mechanism behind this is that these microporosities expand and contract on pressure changes, leading to weakened cement. There is something known as gas pockets. What are these gas pockets? Gas pockets can also be seen in dental abscesses, deep caries lesions, and line restorations. Hence, under the conditions of reduced air pressure, these gas pockets in the body tend to expand, resulting in pressure buildup, which may cause pain, discomfort, and impaired organ function. Coming to oral surgery, oro-antral communication, which is usually observed by extracting a posterior upper tooth, may lead to sinusitis and has adverse on exposure to a pressure-changing environment. As you all know, oro-antral fistula is formed whenever you extract the maxillary posteriors. It could be your first permanent molar, second or the third molar. Most of the time, when the roots are quite lengthy and if there is a traumatic extraction, there are chances that there is oro-antral fistula. So, oro-antral fistula communication, which is usually observed when you extract the posterior molars. So, hence the dentist has to rule out oro-antral communication, and if it is diagnosed, should be referred to an oral surgeon for its closure. See to that the patient or the crew member who is flying should not be having the oro-antral fistula or the communication. Coming to periodontal considerations, due to the decreased salivary flow and dryness of mouth, there is high risk of caries and periodontal diseases. In the aircraft, this dryness of be due to the breathing of dry compressed gases. The responsibility of dentists is to educate their patients about the importance of a healthy diet and encourage them towards upholding thorough oral hygiene. See to that the patients should maintain their oral hygiene well. It's not only for the people who fly, the crew members or the frequent flyers, it's for everybody. See to that the oral hygiene is maintained thoroughly. Good oral hygiene should be maintained. Periodontal considerations. Coming to periodic examinations, occult oral disease should be diagnosed as early as possible, otherwise that could be a problem for crew members. Defective, that is fractured or cracked restorations, restorations with poor retention, and secondary caries lesions should be specially taken care of. To rule out occult pulp necrosis, various tests such as photographs should be performed in teeth with pre-existing extensive restorations. I repeated, periodic examinations, that is, should be diagnosed as early as possible for the crew members as well as the frequent flyers, and defective or fractured or cracked restorations, restorations with poor retention, secondary caries lesions should be specially taken care of. Any defective thing has to be rectified. To rule out the occult pulp, you can use a pulp tester, you can use the hot and cold pulp test or the intraoral periapical radiographs to know the pre-existing extensive restoration. Panoramic radiographs, the OPG, are recommended as an additional occult dental for occult dental pathology and documentation purposes. High prevalence of bruxism among AQs has been observed, and hence dentists should look for signs of teeth attrition. That is, whenever we will come to know various problems in the patient. It could be deep dental caries lesions, it could be a secondary caries, it could be the fractured restorations. Any occult dental pathology can be documented or can be treated before the patient flies, patient or the crew members fly. Coming to flight restriction, the restriction in the flight of a patient is required when some interference in the flight abilities is suspected. That is, we should take care of the air crew members also. If a patient is on certain medication which may cause dizziness or lack of concentration, example analgesics or diarrhea, that is, patients are taking antibiotics. See, again, it can be the air crew members or it can be the patients also. So, just to be on the safer side, always a history is better. That is, whether they are taking analgesics, which causes lack of concentration, or whether they're causing diarrhea because of the antibiotics he or she is taking. In patients undergoing tooth extraction or other oral periodontal surgery, there will be changes in pressure intraorally after several hours. Increased hazard of emphysema. This causes the increased hazard of emphysema. It can cause certain pressure changes after few hours of extraction as well as periodontal surgeries. Facial swelling can prevent jet and helicopter pilots from wearing helmets comfortably. Definitely, whenever there is a swelling, it can prevent the jet and helicopter pilots from wearing the helmets comfortably. That's I'm talking about the extraoral swelling. Intraoral also can cause problems. Wound healing can be hampered in cases of oroantral communication due to pressure changes. To avoid in-flight parodontalgia, a should postpone his flight until the endodontic treatment is completed. Dentists should advise the air crew not to fly until the pain has subsided and the patient can sleep well. It is advisable that dental appointment should be scheduled for a date with a sufficient time interval before the next planned flight. Example, usually the weekend holidays, you can always plan the dental treatment for the air crew members. Aviation dentistry is a new era in dentistry. It is leading nowadays as number of people who travel by air are increasing these days, and hence it leads to an increase in the number of air crew personnel. Therefore, special care should be taken before the problem gets worsened. Complete dental checkup and treatment should be done before air crew patients take off on their flights. There are various aviation. Earlier, the people who would fly also were less, airlines also were less. Now it's almost become similar to your bus stands and railway stations. So there are various aviation courses. There's BBA in airline management, there's a BBA, again BBA in aviation and travel tourism. You can go through the internet. There are various, after your BDS, you can just take one of these graduates or even your masters. There's masters in aviation management, master MSc in aviation. So depending on your interest, because it's then new line for you to proceed and you're all youngsters, you have a long way to go. So you can always decide after your BDS because after a few years it might become mandatory even in the airports to have the dental clinics. Not only that, it becomes compulsory for the patients to see that he or she is treated of all the dental problems before they fly. Thank you for your patient hearing. If there are any questions, you can just ask me. It was a short thing, there was nothing much I could add to that. It's a very new.
Yes, ma'am. Yes, ma'am. Yes. Thank you so much, ma'am. Thank you for giving us insight into an absolutely unexplored branch of dentistry. And thank you for taking some time out of your busy schedule.
Thank you,
Am I
Pranjali.
audible now?
Yes, yes. Thank you for giving.
Yes.
Because much has to be done. That's what I was telling. After your graduation, you can just get into any of these. And sometime I should be able to hear from some of you saying that you have been doing the aviation courses. I would like to hear it. All the best for everybody. All the students, stay home, stay safe. Let the corona go away from the whole world. I'm not talking about India, the whole world. Let everybody, all the people be safe. Thank you for giving the opportunity and it was nice sharing with you. Thank you, Pranjali.
Thank you, ma'am. Thank you. And ma'am, we have two questions. One is, could you throw some light on space dentistry?
Space dentistry. Just very, am I able to see the thing? Space dentistry. Okay. See, as I'm telling you, this area is not explored much. Space dentistry means, see, in US, we have lot of aviation schools where there are certain researchers have been done wherein they do all these things in the aerospace dentistry. That is the aerospace department, they do all the experiments. That is your fixation of your crowns, bridges, extraction, even in vitro and in vivo it has been done. But in India, it's very, very limited. That's what I'm telling you. If you just go through the Google, there are a lot of schools, especially in the Western countries compared to India. In India, we have to start, I'm telling you, it's just the beginning. You have to have gone a long way. Definitely, there are schools in Western countries where you can learn about the air-based things. That's I'm sure, 100%. If you just check in the Google, you'll be able to find that. Next question. Lot
Yes,
of
ma'am. This,
lot of experiments have been done, but again, I'm telling you, very limited in India. Next.
yes, ma'am. The next question was, are there any fellowships in aeronautical dentistry abroad?
Abroad, 100% definitely there are fellowships, there are graduation courses, there are post-graduation courses, fellowship courses, diploma courses. I went to see if I put all those on if I start sharing, it'll be like I'll be what? Advertising them. So go through the Google.
Yes,
I
ma'am.
went through that. I have gone through that. I'm very sure it is very much there. There are fellowship courses, there are diploma courses, there are post-graduation courses and graduation courses, especially in your Western countries. 100%
Yes,
I've checked
ma'am.
through that. But only thing I'm not, I thought of putting, but again, if I put that, it's like advertising, which I'm not supposed to do. So you can definitely check your Google. It's there, it's available.
Okay, ma'am. Thank you so much, ma'am. We won't take much of your time.
No, no, exactly. Is India a good,
Uh,
what is that question which came there? Is India a
is
good?
India a good country to study it in?
India is good country. See, again, I'm telling you, it's an unexplored region where we have to. For example, let me just tell you, 35 years, 30 years back, you might have
Hmm.
you're hearing about lasers now. I did my dissertation on lasers in vivo. All the beginning, all my seniors had done it in vitro. We had to do it in Indian Institute of Science on extracted teeth. I was the first one to do lasers in vivo on patients. This was 25, 30 years back. The same thing now. See, now laser has become day in and out. All the dental clinics are using, they are using lasers for various things. It could be for surgery. Various lasers are there. Carbon dioxide laser, NDR laser. Similar aviation dentistry in India, it is again questionable. Not many. I think your DY Patil has in Mumbai. We were talking about not only in abroad, even in India. I remember checking DY Patil has its fellowship or a diploma course. It is there in DY Patil, Mumbai for your
Okay, ma'am.
courses. It's there. That's on college which I saw. Yes, I saw a question popping up there. It's there.
What are the job opportunities after aeronautical dentistry in India?
100% job opportunities are very good. This is the reviews which I've gone through, and I have gone through the websites also. Once you finish this, because see the I mean, most of the airports they're all expanding. I'm telling you, no, see,
Yes.
20 to 30 years back, flying was an what? It was a luxury, but it's become a necessity now. What was luxury 35, 40 years back, it's become a necessity now. I'm telling you, you find more people in airports than in your bus stands and your railway stations. So when that is a thing, definitely I'm 100% sure most of the airports could start setting up. You know, in all the airports we have dental, I mean, medical teams are there. We have from the central government of India, state government, doctors are posted for certain duties. Similarly, there are no dentists. This they have to exist.
Hmm.
As I'm telling you, most of you as students, you have got a huge organization. You can always write a letter to our Prime Minister Narendra Modi asking him to start dental clinics or dental personnel in all the dental airports because of these things. I'm telling you, now airports in all what was luxury earlier has become a necessity now. Similarly, after 5 years, now only it's millions and millions of flying every day. So till now they have not posted any dentists in the airports. There are doctors who are posted for various reasons. Dentists are posted. Definitely any what emergency treatment or whatever has to be done can educated in airports. And the government has to take certain initiatives. Central government as well as the state government. All of you, I mean, 200 to 300 of you are there. Can always just write a letter with the support of your colleges. We'll see. Or your this thing is there, no? Your dental councils are there. State dental council is there. Or your DCI, write a letter to DCI. DCI can write a letter to Narendra Modi, Prime Minister, and they can start something. Till now, nobody has said. See, again, aeronautic dentistry, it's a very unexplored area. Just now, the youngsters, the again, job opportunity, what was available 30 years back is not available. The moment I finished my MBS, there was opportunity in 4 to 5 colleges. Now we have to wait for some time for a job. Whereas for your BTS after this, after aviation dentistry, there is no looking back. That's what I mean to say. Chances are very much there once you have a course in aviation dentistry. I told you in DY part what should we know to name they are qualified. What should we do from them to know that we are qualified? You can always send your once you have your degree with your BDS, send across your this thing. They should be able to take you for your this. Might be a short interview for you and take you as students. Can this be a part-time job like forensic? Yeah, definitely. Why not? You can have your practice, you can have your teaching now and then. Go to the or open a clinic close to the airport. That would be fine. You're
Hmm.
quite right. I mean, most of the places right next to the airport, they have dental clinics coming out, wherein we have people coming, getting their treatment done and flying back. Because India is supposed to be one of the best for the dental treatments, not only in the part of dental treatment, when it comes to monetary wise also. What they have to spend in dollars, thousands of dollars, lakhs together can be done in much reasonable rates in India. There's always part-time job, question mark, yes, like forensic, fine. Options are there. Anything else?
No, ma'am, that's it.
Thank you all for your patient hearing. Thank you, Pranjali, for giving me the
Thank you,
opportunity
ma'am.
again. Stay home, stay safe, keep in touch with me. All the best for every student, everybody, whoever is logged in, all the best. May God bless you all. Thank you.
Thank you so much, ma'am.
Thanks, Pranjali. Can I log out?
Yes, ma'am.
Right. Thank you, Pranjali. Thank you.
Thank you, ma'am.